Welcome to All Things Keto. I am Dr. Pete, and I am the host of All Things Keto, and I am the co-founder of Ketonic Revolution, along with my daughter, Tanner. Today's topic is going to focus on what we call normal fasting glucose. So when you go to the doctor and you have your blood taken and they run an analysis on it, usually they're going to, somewhere in the categories of the data you get back, will be your blood glucose value. And usually when they do the blood, this is going to be a fasting value, right? You're not supposed to eat anything the night before and other than water until they take your blood the next morning, and then somewhere in the data is going to be this fasting glucose. The reason that I want to focus on this is because oftentimes the only value in terms of your potentially diabetic situation that the doctor is going to look at is going to be your fasting glucose. And there is an issue with this. First off, what I want to do is clarify this morning what normal glucose values, how we came to what they consider the normal range. And then the second thing is that I want the viewer to understand the reason why this parameter is important to you, all right, is because it's related to insulin expression. And as I said a second ago, quite often the only factor that the doctor's going to look at that is connected to the insulin expression that you have going on is the fasting glucose level. And there is an issue with this. To be absolutely abundantly clear about this, the reason why your insulin expression is an issue, and it's related to the amount of blood sugar that you have flowing in your system at any given time, is because the insulin expression is the driving force for the following diseases and ailments. All right. So to be clear about this, high insulin expression is the driving force for the following ailments. And I'm going to read off of a list because I don't want to forget any of them. At the top of the list is type 2 diabetes, whose onset usually is afflicting those of us who are older. Obesity, cardiovascular disease, high blood pressure, stroke, cancer, diverticulitis, peptic ulcers, gallstones, hemorrhoids, and varicose veins. All of these things are related to hyperinsulinemia or hyperinsulin expression. Let's define what the medical establishment considers to be normal fasting glucose. So again, they take your blood after you fasted overnight, and one of the analyses will be to look at the blood glucose. And the normal range is between 66 and 99 milligrams of glucose per deciliter or volume of blood. This is considered the normal range. Now, if you happen to be above that value, depending on how far above that value that you are, then you can either be pre-diabetic or type 2 diabetes. But I don't want to get off on a tangent right now. I want to stick to the concept of normal blood glucose. So again, one of the issues with the medical establishment is the tendency on their part to focus on single point diagnostics. And the purpose of this video is to talk about the fact that you cannot rely solely on normal blood glucose to evaluate your diabetic situation, to evaluate essentially as a surrogate the level of insulin expression that you have going on in your system. And here's why. Now, there is a long history involved in defining normal blood glucose. But what I'm going to do is focus on a medical doctor. His name was Joseph Kraft, who did a lot of research in the 1970s. And his work was culminated and published again later on in a book that you can get yourselves. I'll show it to you here. It's called The Diabetic Epidemic in You by Joseph Kraft. And everything that I'm going to talk to you about today is in this publication. It came out in 2008 and then was republished again in 2011. So what Joseph Kraft did was he looked at over 14,000 different patients, and the experiment focused on, number one, taking their fasting glucose, and then each individual submitted to what's called an oral glucose test, which I'll define here in a second, but also their insulin was measured throughout the oral glucose test. And then that data was correlated with the diabetic condition of the patients. What was exactly the experiment that Kraft carried out on over 14,000 patients? So the first thing that they did was they collected and determined the fasting glucose for the patient, along with measuring the amount of insulin that was in their system at that time. Then the patient was given 100 grams of pure glucose, and the glucose and the insulin was then measured at a half an hour, 1 hour, 2 hour, 3 hour, and in some cases 4 and 5 hours. Then that data was graphed, and the pattern of insulin expression was then analyzed for each of the patients. And what we're now going to do is look at a graphical representation of that data, and then we're going to talk about why it is that if all you're looking at is the normal glucose expression for a patient, that this is a problem. Okay, so here we're looking at the data from the Kraft protocol. And I need to say that I borrowed this slide from a presentation given by Ivor Cummings, who borrowed the slide from the book by Kraft that I showed just a few minutes ago. So remember what this experiment was. So we have over 14,000 patients, and their fasting glucose was taken, and then the insulin was also measured. The patients were then fed 100 grams of glucose, and the blood glucose and insulin was measured then at a half an hour, and then 1 hour, 2 hour, 3 hour, 4 and 5 hour in many cases. I think that every experiment went out to at least 3 hours. And what you can see out of these 14,000 patients is that there was a wide distribution of different types of insulin expression. I want to draw your attention to the blue line, because the blue line represents the insulin expression that you expect for a normal individual, an individual who does not have a predisposition to the diabetic condition. So they were fed the 100 grams, and you can see that by 3 hours, their blood glucose is back down to the fasting level, number one. And number two, the peak of the blue line is just above the value 50 here. And I'm not going to bother to go into the units here. You can do that by going into Kraft's book. In any case, you can see that all of the other lines have two things in common. All of them are indicators of the diabetic condition, the red line being the worst. The first characteristic of all three conditions are the fact that they are all overexpressing insulin. This is hyperinsulinemia, the overexpression of insulin. And for the exact same glucose load, you can see that all three curves, the yellow, the orange, and the red, are pushed way out. So it takes significantly longer for the same glucose load before the insulin expression in those individuals are anywhere down close to to the fasting levels, that the fasting glucose before the introduction of the carbohydrate. So Kraft was able to take that data, and you basically can break his 14,300 and I think it was 84 patients into three main groups. You have the group of patients that fit under that blue line, and these we would say about them that they have normal glucose tolerance. They eat carbohydrate and they have a normal expression of insulin that is required to drive that carbohydrate out of the blood into the cells. And then the other lines, the yellow, the orange, and the red, they represent a range of people who have abnormal expression of insulin. So we would say, and those guys can be broken into basically two different categories. If you look closely, if you go back and you look at the red line, all right, that particular group is definitely type 2 diabetic, all right? Their insulin expression is through the roof, and it pushes out for a long extended period of time. The other two groups are going to fall into a range of what we call impaired glucose tolerance. So their insulin expression is abnormal, and it is trending to type 2 diabetics. If those individuals stay in the dietary, if they stayed in the dietary category that they're in, eventually they're going to be type 2, full-blown type 2 diabetic. Okay, so what I did was I took Kraft's data and I re-represented it so we can see the evidence why just focusing on fasting blood glucose is a problem in the doctor's office. So here's what we're looking at. If we focus on the NGT, this is normal glucose tolerance. So this has to do with the population of individuals that when they went through the oral glucose test had the blue line on the graph that I showed earlier. So 93% of those individuals out of the 14,000 or so patients had a blood glucose where their fasting glucose level was less than 100 milligrams per deciliter. So 93% of those guys fit in the range between 66 and 99. Now, if we focus on the other two parts of the pie and we analyze what that means. So first I'm going to draw your attention to the IGT. These would be the individuals that had impaired glucose tolerance. So they're mainly coming out of the categories that were within the yellow and the orange lines that were in that data. 60% of those individuals had completely normal FBGs that were less than 100 mg per deciliter. So they literally, in their fasting blood glucose, fit in the category between 66 and 99, which is usually measured in the doctor's office, right? When you look at the data and you're discussing with your doctor. Now, if we focus to the point or the blue pie section there, this would be the guys in the red-lined area on that data that I presented from Kraft. These are the type 2 guys. Okay, 20% of them had normal fasting blood glucose that was less than 100 mg per deciliter. So they literally fit in the range between 66 and 99. So the point is, if you go to the doctor's office and you have your blood glucose measured, the fasting blood glucose, and you do no other analysis, it is a distinct possibility that if you have diabetic tendencies, that they could be completely missed. So where does that leave us? All right, so Here's the thing. When you go to the doctor, all right, and not all doctors are the same. I mean, there's a lot of medical doctors out there now that when you go in for your annual checkup, which maybe it's every 6 months or maybe it's once a year, they automatically, when they do the blood work, are going to ask for not only your fasting blood glucose, but they also will ask for the A1C. Now, the A1C is a measurement of the amount of glucose which is attached to your red blood cells. And the reason why this is important is because the average life of a red blood cell is about 3 months. All right. And the amount of glucose that's attached to the red blood cell is directly proportional to the concentration of glucose in your blood. So arguably, this is a more accurate reflection of what your average blood glucose values are. All right. The A1C itself is not infallible. And I'm just going to tell you that. As a professional health coach, I know of at least one person who I've seen data for who has high blood glucose values, significantly high blood glucose values, definitely in the pre-diabetic range, and has a normal A1C. So the A1C is not infallible. But my point is that at minimum, especially if you're in my age group, 60 years old or older, when you go in for this analysis, you need to make sure and assert yourself and ask for not only the fasting blood glucose level, which you now understand can completely miss hyperinsulinemia, but you also need to make sure to have the A1C done. Now, in the best case, most ideal situation, it would be nice to also do the oral glucose test along with the insulin concentrations over the whole range of the experiment. Is this practical? No. Is it expensive? Probably. But I think as those of us out here in this world now, we need to be informed about the situation. And you should know that option does in fact exist. For now, what can you do most easily? Make sure to ask for the fasting blood glucose and the A1C, and don't take no for an answer.